Good morning, Kaylee. Dr. Swanson.
Good
How are you
morning.
doing?
Good. How are you?
Good. Good to see you.
You too.
Sorry you're in again.
That's all right.
Sounds like you're having, continuing to have high blood pressure, which we
Yes.
noticed last time you were in.
Yeah.
And looks like your blood pressure was a little high this morning when they took it. And you've continued to have signs and symptoms of this. So I think what we're going to do today is get you started on a prescription of Atenolol, also known as Tenormin. And this is used to manage, it'll help manage your high blood pressure.
Okay.
It's also used for other things. So if you hear about someone else having it that doesn't have high blood pressure, they may have chest pain. It's also used to prevent myocardial infarction or heart attacks. So,
Okay.
and the therapeutic effect that you'll see from this is your blood pressure should be lower upon taking it, and it may decrease your heart rate as well.
Okay.
So, some of the side effects that you'll want to be aware of are when you first start taking it, you may be drowsy, you may be a little dizzy. So be careful in any activities that you do. Driving, be careful until you know how it affects you.
Okay. Do I have to watch like getting up like at a certain rate, or can I just get up quickly how I normally do out of bed and stuff, or do I have to watch that?
I would definitely watch that. When you get up out of bed, kind of sit on the edge of the bed for a minute or so, just to, because it does lower your blood pressure, makes you a little dizzy, and when standing up, we don't want you to pass out. So
Okay.
definitely be careful when getting out of bed, and moving positions, move positions slowly, and then also make sure you're taking it the same time every day. And if you miss a dose, you'll want to take it as soon as possible unless it's time for your next dose, because we don't want you to double up on your doses.
Okay.
And never stop taking it abruptly, because it may cause your blood pressure to skyrocket, shoot up, and it can also cause your heart rate to fluctuate.
Okay.
And you have an arrhythmia. So we don't want any of that to happen. Also, you'll want to monitor your pulse and your blood pressure before taking it each time. Do you remember how to do that? We taught you that last time you were in.
I remember you helping me last time how to monitor that.
Okay. Give us a call then if for any reason your pulse would be below 60 beats per minute,
Okay.
and if your blood pressure is unusually low for you, give us a call, because we do want to know about that. We don't want you to take the medication if it's too low. Either of those
Okay.
are too low, because it'll cause them to decrease, and we don't want that. Also, give us a call if you have, if you experience any other side effects, difficulty breathing, wheezing, if you're dizzy or lightheaded if it doesn't go away once you start taking it,
Okay.
if you feel confused or, depressed, start feeling depressed, definitely give us a call, and we'll reevaluate, the medication.
So don't stop taking it, just call you guys first, and then we'll see you.
Yep, call us first.
Okay.
So if you take your pulse and it's unusually low, give us a call right away, and then we'll instruct you what to do. We'll probably want you to come in that same day and get you evaluated.
Okay.
So, the other thing with hypertension that we want you to do is try to watch your stress level. I know you're a nursing student,
Yes.
and that's hard to do, but try to watch your stress level. Also watch your sodium intake.
Okay.
So try to eat foods that are lower in sodium. And we'll give you a list before you leave today of things to kind of stay away from.
Okay.
Also, try to exercise regularly if you don't already. That'll help.
Okay.
And then also watch your level of alcohol consumption, because that can have adverse effects with this medication. So,
Okay.
Other things, if you go to see a specialist for any reason and they need to do any type of a surgery, let them know that you are on this, because it can have adverse effects with general anesthesia. So
Okay.
just something to be aware of. And it also has effects on your blood sugar levels, which we don't have to worry too much about you because you're not a diabetic, but just to be aware of if in the future, that would arise, fluctuation in your blood sugar levels and some other things. So,
Okay.
do you have any questions?
No, I think we covered it, but if I do, I'll make sure I'll call your
Okay.
office.
Yeah, definitely give us a call if you're having any side effects that I didn't mention, or if you have any questions while you're taking it.
Okay.
Let us know.
All right.
All right. Well, thanks for coming in today.
Thank you.
Good to see you. Atenolol, otherwise known as Tenormin, by Lindsay Swanson and
Kaylee York.